Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's daily bulletin. Providing relief to the Chintpurni Medical College students who had to be transferred after the medical college failed to get renewal permission for academic year 2014-15. The Punjab and Haryana High Court has recently ordered reimbursement of the dues that the students had paid to the colleges they were transferred to. Further, the High Court bench of Justice Sudhir Mittal has directed the state of Punjab to pay the dues to the colleges. The order of the High Court bench has been issued while considering a batch of pleas against the Union of India and other concerned authorities. The Medanta Hospital on Monday announced the appointment of Dr. Randeep Guleria as Chairman, Institute of Internal Medicine and Respiratory and Sleep Medicine and Director, Medical Education. In an official statement, the hospital said that Dr. Guleria has been appointed to further strengthen its team of doctors who deliver world-class and holistic healthcare. Altogether, 744 MBBS and 9,783 PG seats remain vacant in the last 3 years, Union Health Minister Mansukh Mandavia recently informed the Parliament. Apart from this, the Health Minister further informed that altogether 18,72,343 students registered and 17,64,571 students appeared in the NEET this year. For the academic year 2022 and 23, there are a total number of 96,077 MBBS seats available for admission. He further mentioned in a written statement laid before the Rajya Sabha. The district-level panel of doctors at Noida has recently recommended referring a case of a 17-year-old boy who lost his vision in one eye after a sinus operation at Max Hospital in Vaishali to the Medical Council of Uttar Pradesh. It has been decided by the panel to transfer the matter to the State Council as the panel could not give any conclusive findings on the matter. Informing about the panel's recommendation, the Chief Medical Officer of Ghaziabad said that the reason for such a decision is that the case belongs to super speciality and therefore it should be referred accordingly. For most people, moderate coffee consumption can be incorporated into a healthy diet. About 2 to 5 cups a day is linked to a lower likelihood of type 2 diabetes, heart disease, Parkinson's disease and depression. But researchers have highlighted an association between coffee consumption and incident atrial fibrillation in a new study. According to the research, middle-aged and older adults' risk of developing new-onset atrial fibrillation tended to increase with the amount of coffee they drank, but not consistently. So, however, risk was more than doubled among those drinking the greatest amounts. The study findings have been published in the American Journal of Cardiology. The study was conducted to investigate to find the potential dose-dependent relation between coffee intake and atrial fibrillation incidence in a multi-ethnic setting. There are previous studies comprising wide populations, but there is a limitation of data regarding the exploration of dose dependency.
Osteoarthritis is a common chronic condition that usually causes joint pain and can be severe enough to require knee and hip replacements. In the US, the number of total knee replacement or TKR and total hip replacement or THR surgeries is estimated to reach 572,000 per year by 2030. No medications are currently known to prevent or reverse osteoarthritis. A team of researchers from China, Taiwan and Australia aimed to determine whether metformin use was associated with a lower risk of TKR or THR, as evidence to date has been sparse and inconclusive. They analyzed data from 69,706 participants who received a diagnosis of type 2 diabetes in Taiwan between 2000 and 2012 and compared the risk of TKR and or THR between people taking metformin and those not taking metformin. The mean age was 63 years and half were women. About 90% of total joint replacements were related to osteoarthritis. The US FDA has approved the targeted imaging agent Cytalux or Pafolacianin for use in lung cancer surgery. This injectable diagnostic binds to cancerous tissue and glows when stimulated by near-infrared light, making it easier for surgeons to remove tumors completely while sparing healthy tissue. This is the second approval for Cytalux following an approval last year for ovarian cancer surgery, also based on clinical studies in which Penn Medicine led one of the largest sites in country. New research at Cleveland Clinic expands the link between what we eat and how the gut microbiome impacts our susceptibility to develop different diseases. In this case, how a specific gut microbe generated byproduct is linked to heart failure risk. Elevated levels of phenylacetyl-glutamine, or PAG for short, a byproduct created when microbes in the gut break down dietary protein, can be directly linked to both increased heart failure risk and severity, according to findings published in Circulation Heart Failure Journal. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.